My good friends, Lisa and Jamii Saylor, decided to open a clinic that was in alignment with my morals and values on how to treat patients, having a full hour with every patient and really getting to focus on the individual and healing them and getting them back to what they love to do, to hear them in a private treatment room, listen to them, evaluate them, constantly reevaluate them.
This is gonna be my first podcast, and I ask you just to bear with us here. But I'm gonna be today with amazing Holly Robbins, and for no more wait time, Holly, tell us a little bit about your background and how we ended up meeting each other here.
Great. Yes, we're at Saylor Physical Therapy, which is the clinic we both work at now. We met, when did you start working?
August?
Yeah.
June, sorry.
But so before coming here, I've been in practice for about 20 years now as an athletic trainer and physical therapist. And I've had a couple unique opportunities, one to work overseas in England with professional soccer players, football and rugby, which was wonderful. And the only reason I came back to the United States was because my good friends, Lisa and Jamii Saylor, decided to open a clinic that was in alignment with my morals and values on how to treat patients, because it was lacking previously. As far as coming back here with having a full hour with every patient and really getting to focus on the individual and healing them and getting them back to what they love to do. And so that was probably about 10 years ago now that we opened here.
So you started here from the beginning?
Yes. So in other clinics that were more of the factory-based clinics where it was one patient after the other stacking on top of each other in a communal gym and chaotic. So this is much better.
It's definitely much. I could attest to that because there's been a couple of months here and I already feel the difference. I did one of my clinical rotations, and that also helped to kind of know that it's not just something that they are telling you, it's actually what is happening here. And talking about, you mentioned the values already, but obviously anything else that you love about just having this one-on-one experience with a patient without having to focus on 3 or 4 patients an hour.
Right. So you actually, and as you know, a lot of people focus on, oh, you have a knee injury, so you just treat the knee, whereas we have the time to treat the whole person. And most people are like, oh, I have knee pain. 90% of the time, it's not even coming from the knee, it's coming from somewhere else. And that allows us the freedom to be with the patient, to hear them in a private treatment room, listen to them, evaluate them, constantly reevaluate them. And I just think it's the best kind of
and I agree. The other part that patients love is that we don't switch them a lot between, not that someone's better than anyone else here, but it's just they get that consistent. The first one who saw them most of the time is going to be the one treating them. If it's the physical therapist or the physical therapy assistant, most of the times that's going to be with the patients who they're going to be with. And the patient enjoys that part because they don't like being switched off with a lot of therapists in one care, you know what I mean, for one thing that they came in. So yeah, that's a big part. And giving a little bit of a leeway for the physical therapists that are working on these places that are 3 or 4 patients an hour. It's not their fault most of the time because they just have to face the fact that they have to work with all of those patients at the same time and do documentation, which we also have to do, but obviously a little bit more leeway there and we get a chance to just focus on the patient. But talk a little bit about the football, right? Let's say the right word. It's in the World Cup. I don't want to mess with anyone else here. So let's go ahead and talk a little about your experience with your football.
It's really great when you get to work with teams, again, because Lisa and I, one of the owners here, started together as athletic trainers where we see the injuries happen on the field. You get to actually see the mechanism of injury, know exactly what happened, and then that athlete is yours to take through their whole course of care and then put them back out on the field. So it's a really fun experience, especially working with, I was in Manchester and Leeds, so they're amazing teams, but no preference there. But it's great, and it's really amazing, and that's what got me to here was to being able to take it. It shouldn't have to be a professional athlete to get that kind of care. Everybody deserves a full hour, your hands on them for that time to really figure out what's going on. And, it's like my neighbor, old Joe is just as important to me as a professional rugby player. So we all like to get everybody back to their sports, whatever it is, or if it's just shopping.
And sometimes it can be challenging, because one of the things that are challenging is when patients come in and they don't understand what physical therapy is, right?
Right.
And they expect, let's say, electrical stimulation, they expect ultrasound, they expect massage, right? Mm-hmm. And how do you deal with that challenge when a patient comes and you know that that's what they know? It's not their fault all the time, right?
So then we show them. Yep. So instead of putting a hot pack on you and electrical stimulation for 15 minutes to warm you up, we warm you up with our hands doing joint mobilizations, and we have that time to do that and just educating them. It's like, yes, these things could work and might help you, but it's better to get the manual therapy from somebody who has a little bit more experience than a TENS unit does, or ultrasound for example.
And how do they know? Because with me, they normally, because I always, when I started, I told them, like, okay, I could do a soft tissue mobilization, kind of like work a little bit on neuromodulating tone and working a little bit there and helping it get better, or MOBs. But at the end of the day, the exercises are what's going to make you have control of what's happening to you.
Right.
So I try to kind of like, between the first couple sessions, talk a little bit about the importance of the exercise. Right. So when I start putting more and more, they're not confused about, okay, I just want to get a massage or that. So how does that go with
I educate people the entire hour. When I'm working on them, I'm explaining what I'm doing. So, okay, look, you have a tight muscle here. When we get in there, when they have a little bit more ability, now we're gonna do this exercise. Feel how you have more range. Now we have to strengthen you in that new range so that it stays, and it's all a complete circle. Whereas people, if you just lay on a table and get a massage with no point and purpose, it's nice to decrease stress, and it has its place.
It feels good, right? It feels good.
But we target massage for specific purposes, not just, feel good everywhere. It's going to most likely not feel that great when we're doing massage, and really target specific limitations and then reinforce and strengthen. And then when they feel better, then they believe us after the fact.
And I like the point that you say that we use that range, or we use that that thing that we saw that the patient is lacking. That how do we see it? We actually watch the movement pattern, watch something they do in their daily activity, even if it's picking something from the floor, reaching up. While they're doing those things, what are we seeing? Are we seeing something that could be better, that maybe could help? Maybe it's not the specific thing that is causing the pain, but it's going to help be more efficient when they're doing the activity. And that's what the trick is, working on seeing what the movement patterns.
Right.
Working on if it's some range of motion, mobility, getting the mobility, then strengthening, control, stability, and then going back again to the movement pattern.
Test, retest. If you have a patient that says, I can't bend down to pick up my little dog, okay, so let's do the treatment, and then at the end, let me see you bend down again. And when they're like, oh my gosh, I can do it now, great. We're gonna reinforce that, strengthen you so that you can do it all the time and you don't have to come into me first.
Yeah, and that's the tricky part, right? Because a lot of people think that they don't want to get back to doing what caused the pain.
Right.
But we want to make sure that at the beginning, if this is something acute, something that happened now, we might get back out of it a little bit, but we want to get back to what you were doing that caused the pain, because we want you to be able to do the things that you want to do at home.
Yep.
And that's going to be challenging, but we want to get you there, because that's the focus of physical therapy, right?
That's it.
Yeah, just bringing people back to baseline. And what are the places Saylor PT has? What other places? I know this one is the Palm Beach one.
So now our goal is to take over the world and set a new standard of care. But right now we have locations in West Palm. We have Jupiter, Tequesta, Wellington, in the Orlando area, Lake Mary, and in North Carolina, a couple offices there as well. But it's to show, and you have to be your own advocate and find places, call, ask, how much time does the therapist spend with you?
Making sure that they're on top of maybe the home exercises program too, because that's the hard part. They come here, you do it with us. Let's say you're the patient watching this right now. You do it with us, and then you go home and
1 to 2 hours a week is not enough to make gains. You have to take the tools that we show you and actually do it yourself in order to achieve the optimal results.
Yeah, I love Holly's energy. She's amazing. But yeah, I was going to talk with Holly a little bit of the importance of physical therapy is part of rehab, right? It's not the only thing or the only thing that would help a patient, right? We also have amazing physicians and surgeons and people around the area that have the pleasure of meeting them, right?
Yes.
So can you talk about a little bit of how the process is around getting to physical therapy around here in this, at least in Florida?
Yeah, so again, we're lucky. I happen to be married to an orthopedic surgeon, but I don't treat his patients, though. He's pediatric. But I have the opportunity to have personal relationships with many fantastic surgeons in the area and a lot of people are afraid to go to a doctor. I don't want surgery. Well, sometimes it's necessary, but they're not all surgery happy where they just want to, majority of physicians will examine you, get the imaging that will help us, treat whatever injury so we know exactly what's wrong with you. And then, a lot of the times they'll refer you to physical therapy before they would even consider injections or, more invasive procedures of any kind. And so again, we have personal relationships, and it's important for the physical therapist to have relationships with doctors. So if you have any questions, you could communicate with them directly, either email or phone, whatever it is. It's good to do your research and know your doctors, and it's just a better circle when you have everybody working together for the patient.
Yeah, and going back to the importance of just going and having their opinion is like at the end of the day, you're gonna be the one who does the final decision. So you go over there, they give you their opinion and their expert opinion, right? Mm-hmm. Not their opinion, their expert opinion. And you come with physical therapy, and we also see what things we conservatively can do to avoid as much surgery, right? But at the end of the day, sometimes you need it.
Right.
Sometimes you cannot, if you want to, it depends what you functionally want to do, right? If you want to do back sports, you want to do something active, it could be really important that you get to a surgeon and try to get that done. But what about the thing that caught me is the imaging, the part of the imaging. What do you think about patients that come in and they freak out about what the image says?
Yes, well, I'm a great example. If you were to look at my images, I have herniated discs at every level in my spine. So when somebody sees, I have a herniated disc at L4, L5, and I say, great, I have 12 herniated discs, but I have no pain. So it's not all about the imaging. Mm-hmm. Sometimes it's helpful, and it's an educational tool that you can explain to the patient, okay, you're having this pain because of this, but it's not the be-all, end-all of everything. And a lot of the times, I won't look at imaging first. I'll do the evaluation, because you're going to measure everything anyway and test their strength and look at them. And then I'll look at the imaging and does it correlate and does it line up? But it's more education to the patient that just because you have spinal stenosis or because you have a herniated disc or a ganglion cyst, whatever it is, doesn't necessarily mean anything. You go by presentation of symptoms and what you're able to do in your life and take it from there. I personally, my workout, I do, weights 1 day a week, but yoga and Pilates is my thing. And again, I don't have pain. I have a lot of, if you were to look at my images, I look like I'm definitely Medicare plus, but you would think I'm walking around in excruciating pain, and I don't have pain because of being a physical therapist. I know how to treat myself, and I know what it takes to stay well and address things when they happen, and you don't ignore them for year. I love that when you ask a patient, oh, well, how long have you been having this problem? Oh, about 8 to 10 years, and have never done anything about it. Like, do you think you get better the longer you wait? Or do you think a lot of the times if you address those things, you can fix them?
To your body a little bit more. And what do you say to the people like maybe do all this exercise and like they get the pain, right? So those are the ones that have to make sure that they visit the surgeon.
Right.
Because even if you are, because there's some cases that
right.
They are really rigid. They go to the gym every single time. They come in, I don't know why I have pain. I'm doing everything I need to do. Mm-hmm. In those cases, we have to be professional enough to know that, okay, physical therapy is not enough right now.
Sometimes it's a mechanical blockage. So if you have a torn meniscus in your knee, and you could squat and you could do everything without pain, fine. But if you feel like catching and it's painful, no matter how much physical therapy you have, you can't, correct a structural problem where cartilage is poking part of your joint. So in that case, you might need to have a small arthroscopic surgery that takes 20 to 30 minutes, and then your pain would be gone, and then you strengthen and go about your way.
Yep. And the good part is you already had a little rehab before, which
Right.
helps kind of like with the process after. You get the small surgery you got after that.
And that's why most physicians, and you have to be wary of the ones that don't send you to physical therapy first, because a lot of the times, if you just correct the muscle imbalances, the problem can go away on its own. But either way, you're strengthening in preparation for either your life or prepping for surgery and getting your body as strong as you can beforehand. So either way, it's beneficial if you have a good therapist.
No, I totally agree with all those things. Let's talk about, just to kind of like finish up, at least for today, because I have a lot of things I want to add with Holly, but let's do a little bit about what we have here in the clinic, the Pilates stuff.
It's amazing. And I don't even know if Pilates has been around for 80 years, 100 years, I don't even know, but not that long. Like yoga goes back a lot longer, but Pilates is wonderful. Joseph Pilates started it. I am by no means an expert, but we are fortunate enough to have all of the Pilates equipment in our studio. So we have the Cadillac and the reformer and the chair and the springboard that we have access to help rehabilitate our patients. And in my mind, it's the greatest thing ever because it just incorporates so much the lengthening and the stability and just strengthening in it's not as aggressive and painful, and it's just low impact and wonderful, and our patients really love it.